The overall mission of our program, Movement Disorders Program, is to diagnose and treat and eventually cure disorders that affect movement. Parkinson's is by far the most common one we treat, but all sorts of tremors we treat, genetic movement disorders, some rare disorders, dystonias, so a variety of them. So one of the unusual and special things about our program is how closely the clinicians work with the basic scientists, and often they're the same. So, for example, I have a basic science lab, but I also see patients, and we have several MD PhDs that do the same. And that gives us a really special insight into the patient. So we have a better understanding when you're studying in the lab, what are the molecular basis of things going on, how it affects the nervous system. So it brings a whole different level of insight into how we treat the patients. And from a patient standpoint, not only do I think they get superior care, but they're also directly linked with the cutting edge.
So within movement disorders, we will generally see folks who are coming in for additional opinions to confirm diagnosis, but also to discuss treatment strategies. And we're at an exciting time in neuroscience now where we have a number of different strategies and treatments to build into each person's care program. We use our expertise and our experience here to help guide patients in that journey and try to suggest things that we think will be helpful and to consider those things along the way, including some of the cutting edge techniques, but also just a better knowledge and understanding of the old standbys and the tried and true treatments, and really trying to incorporate both. There's also times where we aren't able to make significant interventions and we don't have a way right now of stopping or slowing down these diseases. There's a lot of research underway to try to figure that out, and we'll be able to incorporate that into the care plan over time as well.
My lab studies mostly Parkinson's disease. Most of my clinical work is in deep brain stimulation or neuromodulation. And we now know that Parkinson's disease, many of the abnormalities we see or the difficulties are related to dysfunction in brain networks, and that stimulation such as deep brain stimulation modulates those networks to improve some symptoms. But unfortunately it only really is successful at treating a very specific subset of symptoms in Parkinson's disease. And patients are all very different, and only a small group of patients actually benefit. So a big part of my work is trying to expand how DBS can help people by understanding other aspects of the disease. What are the brain networks involved in those symptoms that don't benefit from DBS right now, and how can we potentially modulate them in the future? So we are really interested in using the most advanced technologies to improve the symptoms that are responsive now, but also we know there's just so much room for improvement, and I think part of doing both research and clinical work shows us the areas where our current treatments really aren't sufficient. We see the kinds of things that our patients continue to suffer from despite our best efforts, and so a lot of the real reward that we get in our day-to-day is trying to find solutions for those things that we don't have solutions for now and push the field forward.